All right, Jess. Patient assessment medical. You have 15 minutes to complete the skill sheet. Do you have any questions?
I don't.
Okay. So you are dispatched to an 18-year-old female at the gym that's unresponsive.
Okay. BSI, is my scene safe?
Scene is safe.
All right. So, nature of illness, unresponsive. I'm going to say, is this my only patient?
Yep.
Okay. I'm going to consider assistance, but at this time I don't think I need it. And I'm going to consider C-spine of the patient.
Okay. You walk in. They're at the gym. Friend meets you at the door. Says that they were working out, and her friend started to feel lightheaded and said that she needed to lay down, and then went unresponsive.
Okay.
So you find her laying on the floor next to the treadmill, unresponsive.
All right, so general impression is going to be poor. The patient's unresponsive, laying next to the treadmill. I'm going to approach and assess responsiveness. Do
She's
I get
responsive to pain.
responsive to pain? Okay. I'm going to look for any life threats at this time. Any bleeding? Anything that I need to notice?
Nope, no life threats.
Okay.
While you're looking over her, though, you notice that she has a medical alert bracelet
Okay.
that says that she's a diabetic.
She's diabetic. Okay. All right. I will go ahead and assess airway, breathing, circulation. Airway, is it patent?
Yep, she is able to maintain her own airway when she's aroused with pain.
Okay. All right. Breathing, is it, how's breathing? Equal, bilateral?
Yep, she's moving good air, equal bilateral, at a rate of 15.
15? Okay. At this time, I would consider an adjunct, but patient seems to be maintaining their airway pretty well, so I'm going to move on and check circulation. What's the patient's skin color, temperature, condition?
Pale, cool, diaphoretic.
Okay. I'm going to go ahead and treat for shock and give high flow oxygen. Blanket and to keep patient warm.
Okay.
This is going to be a high priority transport. Let's get the patient going. Unresponsive, unsure what the coma, the origin of the coma. So now I'm going to get a sample history or OP and OPQRST.
Okay, so sample history, signs and symptoms. She was responsive to pain.
Mm-hmm.
Her friend says that her bracelet says she's not allergic to any medicine,
Okay.
that she is a diabetic,
Okay.
and that she takes Lantus.
Lantus. Okay. Is there any evidence that there's insulin pump or anything that she has on her? Or
No,
anything
she's
like
old
that?
school.
Okay.
She draws it up and gives it to herself.
Okay. All right. And so the friend said the patient felt sleepy and just lay down. Did the patient fall?
Nope,
or-
she lowered herself to the ground before she went unresponsive. They the OPQRST, they've been trying to lose weight together, and they've been running pretty hard. She's on a pretty strict diet, hasn't been eating, but has been taking her blood sugar medicine as normal.
Okay. All right. So I'm gonna have my partner get a full set of vitals, including glucose.
Okay, glucose reads low on your monitor.
Low. Okay. So at this time, I'm gonna go ahead and get an IV, 2 large bore IVs, and we'll give. At this time, we can go ahead and start giving. I'm gonna choose D10, and I'm gonna give a 250 milliliter bolus of D10 and reassess blood sugar.
Okay, so that's bolused in after 5 minutes. Do you want your vitals first?
Yeah, can I get blood pressure?
Yeah, your blood pressure is 120/80.
Okay.
Pulse is 100, regular.
Okay.
Respiratory rate is 22. And quality's good. You did your BGL of low.
Mm-hmm.
Okay, the bullet's in. Her blood sugar now is 110, and she is alert.
She's alert. Okay. All right. I'm going to go ahead and get a further sample history from the patient herself. And
Yeah, she's not allergic to anything. Just takes Lantus, and she's a diabetic.
okay. And at this time, I'm going to go ahead and reassess all my interventions, my IV. I'll go ahead and get a cardiac monitor in place and check the patient's for lead on the patient.
All right, it's 100 sinus rhythm.
Okay, and so we're gonna keep going to the hospital and have the D10 hanging still. There's still should be another 250 milliliters if we need it, and and then we're just gonna get to the hospital, and I think I'm done with this patient.
Cool.